Welcome to our regenerative medicine presentation today. My name is Dr. Michael Bandman. I own 3 clinics in the greater Phoenix area in Scottsdale, Tempe, and Gilbert. And I want to talk to you today about some information that could be very valuable to you if you use it to transform your life. It's really worked well for my family and I. If you can see here, let's point to my knee. My left knee, I blew it out, and I'm going to tell you about that a little later on. But it's amazing when you get injured how it can truly impact your whole health. So we've had firsthand experience with this, and we always draw back on the founding principles of health and the laws of health, how they work and how our body heals in order to determine what type of care is going to be best for the people who come into our office. For the past 17 years, I've been taking care of people and helping them improve their nervous system. And we've noticed that when people do the right things to protect and help their brain and their nervous system heal, that they can recover tremendously from multitudes of conditions. I think we've got into a lot of problems thinking that doctors help fix or cure problems when the cure already exists and lives inside of our body. So stem cells that we're going to talk about today, these types of procedures that we do, they're ultimately controlled by how your brain talks to the rest of your body. So for your heart to beat, for your lungs to breathe, for a cut to heal, your brain has to send a message through nerves and heal a specific area or a specific dysfunction in the body. The reason regenerative medicine has become so popular is because only about 1 in 1,000 people make it to 65 years of age in the US and do not consume drugs or engage in surgery. And we kind of see that as something that has become a crutch to health. And sometimes those quick fixes are necessary in emergency and trauma situations, but a lot of the chronic problems that we face and experience are completely avoidable if we can change our lifestyle. The really cool thing about regenerative processes nowadays is that they can add years to your life and life to your years. So I want to introduce you to a couple of patients as I present this information to you so that you can actually understand what people are coming into the office for, and you can also understand how this could impact your life and give you your health back. So we're going to start with Claudette here.
Hi, I'm Claudette, and I have come to Dr. Mike because I was in extreme pain with my back from a car accident, and I had a very bad knee with arthritis. The first procedure he gave me was remarkable. I had 1 week in my knee and I had no more pain. My back is like 35% better and I'm expecting more. And I recommend this procedure. It's awesome.
So Claudette had 4 injections. She had 3 in her back and 1 in her knee. But she used 2 separate procedures, her back and her knee, to come back from a car accident, as well as from chronic problems that she'd experienced over the course of her life. She had tried multiple things. She tried going to physical therapy. She tried medication. She really wanted to avoid surgery, and those are the people we're finding are getting the best results. The reason regenerative medicine is becoming so popular in the news and the media, as well as in your communities, the people you talk to. A few years ago, people didn't really know or understand what this was, but now there's a great amount of knowledge out there. It's because of the opioid epidemic and because of the pain and dysfunction that people are experiencing at an even greater rate. America truly has an issue with the health care system and the results of the healthcare system. We make up about 5% of the world's population, and we consume over 75% of the world's medication. So that's a big issue. because we get caught on this typical treatment cycle that is not getting great results for people. If we take the example of having a hip pain or pain in any joint for that matter along your spine, your knee, your shoulder, your elbow, your wrists, your ankles, these joints can get painful over the course of time. We see a lot of people now, even starting in their mid 30s, where they're feeling achy and stiff, and their joints are a problem. So typically, someone would start with joint pain, and then they would engage by taking, say, a Tylenol, an NSAID. Their pain would either go down, but generally over time it's going to stay the same, and eventually it would increase. So then they would take stronger pain pills, as we could see here. Then they would probably go to their doctor or a healthcare practitioner, a chiropractor, and someone would do x-rays for them. At that point in time, they kind of have a choice. If they're following the typical medical treatment of managed care, because that's all this is managing this cycle of care. That's why it's called managed care. Your insurance companies take care of managed care because it keeps you in this loop. But you take x-rays, and then you have a cortisone injection, say, or you might have some other pain injection, a pain block, a nerve block. And then when that wears off, then typically you're going to get an MRI. At that point, you've usually consulted with a surgeon. You might even choose to do minor surgery. And then when the minor surgery has quote unquote fixed your problem for a few years, then you're going to engage in a major surgery for the hip. It's usually a replacement. That will usually relieve your pain and your symptoms for a while, but eventually your joint pain is going to come back. And then you start all over again. So this continued cycle of managed care has actually produced the opioid crisis, and it's not a good thing. It's actually killing 1,000 people a week approximately right now in the United States. And it's just created a lot of devastating problems in people's lives because we're not truly fixing the problem. We're just staying in that managed care cycle. That managed care cycle has a certain philosophy that they use, and they talk about dealing with your problem when you have pain. And if we take a look at how disease actually develops over time, when a disease starts, it usually takes anywhere from months to years to develop. But once that development starts is not the time when you feel the pain of that disease. So if just some small examples, if we talk about heart disease or cancer, these things take multiple years to develop. And heart disease, for example, 50% of people don't even know they have heart disease until they are killed by their first heart attack. And I'll show you why here. It's because your symptoms actually don't even start until halfway to full completion of the disease process. So you have to lose, on average, 50% function in order for you to actually feel the pain or the symptoms of a disease. This is a backward system because truly we should be taking care of a disease in this section. We should be starting to explore our health and the things that will make us healthy in this section, in the first 50%, even before the symptoms occur. But with managed care, we're waiting until we have pain and dysfunction in order to get back this way. So in a true healthy model, we would deal with all our problems on this side of the timeline. But really what we are doing is this. And that's why stem cells now, regenerative therapies, they're so valuable because we can actually use these procedures to take us back over to this side of the disease process. When we're out in the community doing dinners and talking to people, a lot of people are telling us that this is an experimental thing. In our understanding, this has been around for 40 years. Even we have recorded use of regenerative therapies back in 1913 in the scientific literature. These therapies have been around for a long time. I think the reason that you haven't heard about regenerative medicine is because it has been so expensive up till this point, and it's been for we call it the rich and the privileged. Um, People like Mel Gibson have actually flown down for hundreds of thousands of dollars to other countries outside of the US and taken their family members, the people that they care about, to actually do regenerative therapies. Peyton Manning, even though he underwent surgeries that failed him, and ultimately he had to use stem cells to help repair his neck. Steph Curry has used regenerative therapies to get him back on the court in a really accelerated period of time compared to the people that are doing traditional medical treatments. We see quick recovery, we see quick results, and we see people get out of pain and dysfunction very quickly when they use these therapies compared to surgery. The products that we use in our office are all cleared by the FDA. They're donated by healthy moms, and these moms and dads are screened. Their health history is screened, their blood is tested, and the baby also has to be screened when it's born to ensure that it's healthy. Even if a mom has had a tattoo within the past years of her life, her cord cannot be accepted due to toxins. So these cords are not just taken and sold, they're actually donated to science to avoid any problems with the standards, the ethical standards of collecting these cells and these tissues. They are regulated by the American Association of Tissue Banks, and the lab that we use has 60 people that just their full-time job is to work on quality control. So there's a lot that goes into harvesting and using these cells. There are two different types of cells that we've used in the past. There's hematopoietic stem cells, which are the ones that are found in your blood cells, and they're the ones that form red and white blood cells. They're found in the umbilical cord, and they could be transplanted into a human. Or there's mesenchymal stem cells, which are the basic connective tissue for mostly all your tendons, cartilage, ligaments, muscles, but also for your organs, your nerves, and your skin. So mesenchymal stem cells are the ones that we use for the most part in our office to help people recover and heal from the problems, the pain, and the dysfunction that they're going through. The stem cell is an amazing cell. It lives in your body and is activated by something called a periocyte, but it can transform into all these different cells. It can replicate itself to become another stem cell. It can become a muscle cell, a skin cell, a tendon, a bone, an organ, or a nerve cell. And how it does that is by actually communicating with the brain and reactivating healing in an area. These cells are collected from the umbilical cord of a live, healthy baby. So we know that the tissue, the Wharton's jelly tissue of the umbilical cord, is the most abundant source of mesenchymal stem cells that we can collect stem cells from. But when we look at how the baby is protected, Wharton's jelly is one of the protective layers in the cord that helps protect the baby as it's growing. Also, there's amniotic regenerative products that come from the internal layer, which is the barrier that protects the baby from the mother's immune system. So these two cells are full of great cells and building blocks and framework for regenerating new tissue in your body. Cord blood is actually a very rich supply of stem cells as well, but the most viable and abundant source of mesenchymal stem cells comes from the Wharton's jelly. The reason people are seeing such great results when they use mesenchymal stem cells, Wharton's jelly product, is because of the fact that your stem cells really quickly diminish after 20 years of age. You use about 90% of your stem cells by the time you're 20 years old, and you use 99% of them up by the time you're 40, according to Arnold Kaplan. The other study that he did was he wanted to see the replication rate of these stem cells in a lab. So he put one newborn stem cell in a petri dish, and it produced 1 billion cells in 28 days with a replication time of about 20 hours. Then he took an older stem cell, a 60-year-old stem cell from a human being, and he put it in a petri dish, and it took 60 hours to replicate, and it only produced 200 cells in 28 days. So the point of this whole exercise for him was to show that the majority of growth and healing happens when you're younger, and as you age, your stem cells in your body start to decline. You go from having 1 in 10,000 of your cells being a stem cell to 1 in 2 million by the time you're 80. This literally explains the aging process, and the stem cells are the major component that direct and guide healing messages between the brain and the body to generate healing for you. PRP is another regenerative product that we use. PRP is taken from your own body, and although it doesn't always, we can't guarantee that there's stem cells in there, especially as you age. We know that there's plenty of building blocks, and there's plenty of healing factors in your blood that are going to help you get the most amount of healing at different stages of life. So how we typically describe the need for regenerative products like Wharton's jelly versus using PRP is based on a few things. It's based on your age, and it's based on the amount of pain and dysfunction you have, and it's also based on the amount of trauma you have. So there has to be a good workup done initially to determine what your problem is, where your dysfunction is coming from, and what is required for you to get your expectations out of these different procedures. In my opinion, chiropractors are the best at looking at the human body and the anatomy and understanding how the nervous system controls and heals and helps the body function to its highest level. And they are great at doing exams to help you determine where your dysfunction is coming from. So stem cells are the building blocks with any cell in your body, but they have some amazing regenerative properties to them. They have growth factors, over anywhere between 300 and 400 different growth factors. There's proteins, collagen, hyaluronic acid. There's 200 times more hyaluronic acid in regenerative products than there is in that Synvisc, Monovisc, those things that you can get in your normal doctor's office. And stem cells have an amazing ability to assimilate into an environment because they have a molecule called immune privilege molecule, which means that they are not rejected when they're injected into your body. None of these products come from aborted or fetal tissue. That in 2001 there was an act signed by the government that said that was illegal. It's illegal to use aborted fetal tissue to try to regenerate new tissue in a human body. And so these are all ethically manufactured and produced, and they are part of a normal process that happens in your body. You have stem cells. This is an electron micrograph picture of your picture of your stem cell environment. That bump on top of that blood vessel is called a periocyte. And when the nerves tell the pericyte to activate a stem cell, the stem cell will actually differentiate into what the message tells it to do. So it can become some more cartilage, or it can become some more meniscus. It can become some more bony tissue. It can become more nerve tissue. That's the amazing part about having these things injected, is they will do what is required of them. They do 4 things. They actually decrease inflammation. They help decrease scar tissue. They regenerate new tissue that isn't there at this point in time. And they also help regulate your immune system. Those 4 things are an amazing part of any healing process and procedure. And the reason we use umbilical cord tissue, if you look over the Wharton's Jelly product, it checks off the most boxes according to the International Society for Cellular Therapy, which is the people who define what actually a stem cell is. But I'll just draw your attention to a couple of areas. There's the most viable stem cells in Wharton's Jelly product, and they are the youngest source, which means they heal effectively and quickly. So if we talk about what a regenerative process looks like in our office, it's not like a surgery, and stem cells themselves are not like a drug or a surgery. They don't wear off, and there's really, for the most part, for 90% of the people, there's no need to do multiple procedures. This is usually a one-time procedure. It takes about 1 hour in the office. There's no anesthesia. There's no hospital stays or antibiotics. You literally walk out and you have no recovery time. We ask people to relax and let their body heal the way it was designed to heal for a couple days, but there's literally 0 recovery time. We've seen that people like you get results in 1 to 3 months as far as what the symptoms that they're experiencing, the pain and dysfunction they're going through. We see them get better within 1 to 3 months. And on average, we see changes in x-rays over 8 to 12 months. So we see structural change happen within 8 to 12 months. There's minimal adverse effects. We have seen swelling sometimes, or mild pain at the site of an injection that you would normally experience with any needle. We have not seen fever in our office, and we have not seen a ton of swelling as far as after the injection, the joint swelling up. So we are very used to dealing with challenging cases in elderly people. We take x-rays when we do an exam, if those are required. And this is an x-ray of someone who's actually physically standing upright, but this is the side profile of a neck. And this person has a severe hunch in their back, a severe forward head posture, anterior head carriage. And that's putting a lot of pressure on their nervous system, and their body's not healing the way it should. This one, looking from the front to the back on the right side here, this should be straight up and down, but it's actually bent to the side. And these are the types of people that we're seeing that are using regenerative procedures because they have problems that have built up over the years. This is another patient who experienced a procedure in our office.
I told Dr. Mike today that this is the best I have felt in 15 to 20 years. I was to the point of desperation. I hurt all the time in my neck and my lower back. I was skeptical that this would work. However, 4 days after the infusion or the stem cell injections, I didn't have any pain. It was almost too good to believe. I just was amazed. I had a few roller coaster days, but I feel fantastic. It's been 2 months, and now I'm into the process of the chiropractic methods that Dr. Mike is using, and those are even helping me further. So I'm thrilled, and I really highly recommend it for anyone who's looking for an alternate to surgeries and the high cost of surgeries and also the downtime involved in surgery. So I'm thrilled. Thanks again.
So this person came in with this testimony that we just heard. They came in with the desired outcome of being able to continue to work without pain and not becoming disabled. So we see a lot of people are willing to invest in their health when they know that their outcomes are going to get them the type of health that they're looking for. This is another picture of someone who came in for their knees. So if you look here on the right, this is taken 3 months after these pictures were taken. These are separate photos. These ones were taken together. But this is a right knee, and if you look right through here, you can't even see the plateau of the tibia here. And 3 months later, we can see that the tibial plateau is becoming apparent. The space is increasing on both of them, and this person's knee pain is going away. This is someone who thought they would need a knee replacement surgery, or they were told that.
Well, I've been suffering with knee pain probably for 25 or 30 years. I had an injection in my knee about 8 weeks ago with a PRP, then follow up 4 weeks ago, and I've been walking pretty much pain-free since then. So awesome. And I am not quite 70, but almost. I'll be 70 in August.
So this is another example. It's from July 2016. You can see in through here, there's major crowding of the space. You can see here how this space is opening on the exterior, the lateral part of the knee. See how this knee is actually grown. This person had injections on both knees. So we have a lot of examples of people like that. But again, these procedures are things that we sit down with you and talk to you about during consultation, or we talk to people over the phone. We have a lot of people that travel from out of state, even out of the country, to come here to our office to get injected. And we determine what the best course of treatment is for you by doing a consultation first. This is the lady from Texas who wanted to share her experience with you.
Hello, my name is Joanne Majors, and I hope you'll just take a minute to listen to this short video for Dr. Michael Banman. I'm from a small area in Central Texas, and I got on an airplane and flew to Phoenix so that I could see Dr. Banman to have some stem cell therapy. One of the things that you won't know about me is from this video is that I'm a professional speaker, and professional speakers need to stand and be mobile and be able to move around. And for over 2 years, I've suffered with issues with my back, chronic pain. I actually also had a cervical surgery, and didn't think there was any hope for me. But it's not the stem cell therapy that I want you to hear this about. You'll have plenty of professionals that can tell you that. What I want to share with you is the care, skill, and judgment that Dr. Banman used and the way I was treated when I flew out there. In dentistry, we work in dentistry. My husband's a dental provider, and one of the things we know is we deliver customer service to a much higher level than most people. And when it's your business, I'm in the business of training doctors and teams how to connect with people. You're a little more, let's just say, snobby about where you go for service. And what I will tell you is I would get on a plane again and I would go back to see Dr. Mike. As a matter of fact, in the 2 weeks since I've been there, I've referred him 4 patients who are all going to get on an airplane and fly out to see him. You can find somebody to give you care, but you can't find somebody necessarily that cares for you like Dr. Mike. And I want to urge you, the way that I was treated before I got there until the time that I left, and even still the calls to check on me from he and his team, has been far beyond what anyone could have imagined. So I hope that you'll take a moment and listen to what can happen for you and how you can be closer to pain-free. I'm off of 4 medications. My diet has changed dramatically, and I'm less foggy than I've been in years. And I got to tell you, at 57 years old, I feel like I got an extra 20 or 30 years just from the treatment and how I'm feeling. I know it's not over, and I know I've got a lot of work to do because part of it is on me. I didn't get this way overnight, and he couldn't fix me that way either. But I hope that you'll consider seeing Dr. Mike for care, because one of the things that I can assure you is you won't find people who care for you better than he and his team. Thank you.
So our desire is to help people. Our mission is to help people stay off drugs, regain their health, avoid surgery, and be able to live the quality of life that they expect that they should be able to live. And just like Joanne, we want to treat every patient with our utmost care, and we want to do our best job to help people get results. We want great results for you. That's the part that's so disappointing about our healthcare system is I'm okay with spending money on my health as long as I get great results, and I'm sure that you feel the same way. We're spending a ton of money in the healthcare system, and we're not getting good results. And it becomes a bit challenging to understand how much it's worth because we can put value on things like a car or a house, and we could say what it's worth because we can physically, tangibly see it. But when it comes to our health, it's a little bit more challenging to understand how much our health is actually worth because it's really priceless. And I had an experience back in February of 2018 where for 17 years I've been educating people on how to stay healthy, how to avoid surgery, how to avoid drugs. And then one Monday night, late at night, I was playing men's league basketball and I blew my knee out. So this is my MRI. It's a pretty bad injury that I got. The surgeons told me it was the worst injury that they'd seen in quite a while for a young person. And to summarize, what happened was I basically tore all the ligaments in my knee, both my menisci, and a couple muscles and tendons I tore up, and then this sheath of tendon in the front of my knee I tore up. Basically all I had left was a PCL, posterior cruciate ligament, and skin that was holding my knee on. It was pretty bad. So I crawled up, I left the gym and drove myself home and crawled up the stairs and then put myself in bed, and I laid there for 3 weeks and my knee started to swell up. I don't know if you can see that black arrow there, but there's a big dent in my leg right here where my knee was completely swollen. And this is my knee. It was really swelled up. And even with putting a compression sleeve on it, it swelled up like crazy. For 3 weeks, I couldn't put any pressure on my knee. And as I was laying there, I was remembering back to when I could run and when I could get up and even just go to the bathroom, and which I couldn't do. I had to crawl to the bathroom or use crutches or a cane. And it was really disheartening for me. It was really disappointing because I thought now I'm going to have to do surgery just like everyone else. And now I'm going to have to modify my lifestyle. I'm not going to be able to do the things that I love to do. I went and saw the surgeon. They told me we could reconstruct your knee, do complete reconstruction of your knee, but you'll never get your range of motion back and you'll never be able to run again. And that was really emotional for me. It was really disappointing because here I tried my whole life to be as healthy as I could, avoid medications, avoid surgery, and now I'm stuck just with the same problem that everyone else has. And it seemed to come out of the blue. Like there was no rhyme or reason why that should have happened to me. And so I can really relate to people when, as they get older, even if they go through a trauma, that why is this happening to me? And am I ever going to get better? Am I ever going to be able to do the things I love to do? So I started to look into this regenerative stuff, and this regenerative stuff, I mean, nothing in life is 100%. But the more I looked into it, the more I saw the amazing impact it was having on people's lives. And so I went through a whole decision process. The decisions I was making was based on the questions I asked. I was skeptical about it. I didn't know if it was going to work. And so typically, I want to know if health things are going to work before I try them. So what if it doesn't work? If it didn't work, I have to be able to deal with that. How does it affect my quality of life if it did or didn't work? If it did work, I could possibly get my quality of life back. But even if it worked 50%, I would be way better off than doing the surgery. Will I be able to run again? I wanted to be able to know if I could run again. And when I took all these things into consideration, of course, cost was an issue. My insurance didn't cover this. and I had to pay out of pocket. I had to actually get a loan to make this happen for myself. And then what other options did I have? I could do surgery with really poor prognosis. I could leave it and have a really unstable knee, or I could do rehab and try and fix it that way. But I knew from knowing the anatomy that my knee was going to be unstable if I didn't do something. And the last thing I want to know is how long was it going to take for me to get back to working, running my business, and taking care of the people that I cared about in my office. So that was my decision process. And one of the big factors as well was that my wife and I had made plans to go on a trip. I'd surprise her with a trip for her birthday to Hawaii. And that was at the end of May. I'd had my injury in February, at the end of February, and I finally decided to go ahead with my procedure. My procedure was a stem cell injection into my knee with a PRP injection follow-up, and I had to pay out of my pocket about $10,000 for that to happen. Thankfully, the prices have come down for people now, but at that time it was $10,000. And May 1st, I walked into my appointment, or I hobbled in with crutches actually. And I couldn't put any weight on my knee. I couldn't walk properly. And May 1st, I had my procedure. And within 1 week, I was not using my crutches. And 3.5 weeks later, I was swimming in the Pacific Ocean in Hawaii. That's how fast it worked for me with a devastating knee injury that I had. Thankfully, I had a lot of fears that it wasn't going to work. Would it work? What kind of prognosis would it mean for me? Would I be able to get back to doing the things I love to do? And we were just so thrilled that we were able to not interrupt our lives in that short period of time. It's amazing. I would have never recovered from surgery that quickly, and I would have never been able to be on my trip. I would have canceled my plan. So the biggest lesson for me that I learned throughout this whole thing is that your whole entire health is affected by the pain and dysfunction that you have. A simple procedure, this is one of me getting a booster, a PRP injection in my knee, a booster shot. This is a year later. And this was almost 1 year later, I climbed up Camelback Mountain, which is a pretty tough hike in Scottsdale, Arizona, without any crutches or assistance or even a brace on my knee. So it's pretty amazing how quickly your body can heal when it's given the right environment to heal. But the biggest thing that I see is that people come into our office too late. They wait and they say, well, I'm going to wait till it's gotten this or that bad. But this regenerative procedure, these regenerative therapies that we're doing, these injections, it's not too early or too late. My daughter's a high-level soccer player, and she got injected because she broke her arm. A girl fell on her. She broke her arm, and we injected her. This is something that we use for our family to help our bodies heal and regulate before it's too late, before arthritis sets in, before we have to take drugs or do surgery. This is our go-to to help our family live the highest quality of life and the highest quality of health in our life. So we want to help you make a plan. That's the bottom line. We'd love for you to give us a call at the office. We'll consult over the phone, or you can come in if you live locally. We have people flying this week. We have someone flying in from Canada to get an injection. We have people from all over the world who have come in here, and we'd love to help you. So we will consult with you for free if you come into the office. If you want to consult over the phone, you can call us at 480-842-8787, 480-842-8787. The number will be in the link below this video. So you can call us. You can look us up on our website at alignedlifemed.com. but we really want to help people transform their lives. We want to see them avoid drugs, avoid surgery, avoid pain and dysfunction in their life. Our number one goal is to help people live at the highest level of health possible. So we would love to hear from you. If you have any questions, you can type them below. If you have any comments, please like our page, and we would love to hear from you so that we can get involved with helping you make a plan for your health. Thank you, and I hope you have a great day. We would love to hear from you soon.